Well, the Pfizer vaccine was found to be 95% effective with no serious side effects. One trial volunteer who believes he got the actual vaccine is urging the FDA to authorize its use.
I don't live in fear. I have to take the basic precautions that everyone else does. I have to follow the rules, but I do not fear COVID-19 anymore. And I want all Americans to stop fearing COVID-19. And with this vaccination, I believe that's possible.
Once Pfizer gets the green light, 2.9 million doses will be sent all out across the country, including right here in Louisville. So what happens once it arrives? The Night Team's Tyler Emery is joining us live right now to break it down and what she learned from Metro Health. Hello, Tyler.
Hey there, Doug. The public health department here won't actually be administering that first round of vaccines, but they will be responsible for overseeing the entire rollout of what Kentucky's public health commissioner today called a modern medical miracle. Kentucky is expecting to get nearly 40,000 doses of the Pfizer vaccine next week, with Louisville's shipments first going to the major hospitals.
It doesn't do any good for us to wheel out the coolers and take vaccine out to people if they don't really understand what it is they're getting and why they should get it.
Paul Kern with the Louisville Metro Public Health Department is part of the mass vaccination planning. And he says the availability of the vaccine is extremely limited to start, but the rollout will eventually ramp up. Many more providers will then be able to give the shot at drive-through sites.
They do expect at some point to have extra vaccine, and we'll have more vaccine than people to be vaccinated,
including sites like this one downtown, according to the chief nurse of U of L Physicians. But that will take weeks to months. And for Metro Health, the priority is ensuring diverse communities have access and education on the vaccine.
We'll make every effort to get people scheduled for their second vaccination when they get their first.
That will be one of the biggest growing pains of the rollout, Kern says, along with availability.
People say, well, this is kind of the light at the end of the tunnel, but I don't want people to get overconfident.
We don't know exactly how long that immunity will take to build up. So those patients who even receive the vaccine should continue to wear a mask, continue to social distance, continue to wash their hands, just like all the rest of us.
The chief medical officer of Baptist Health LaGrange says immunity could take weeks to build up, but the real test will be the waiting to get the shots.
People just need to be patient. They need to understand that, we're not going to have all this all at one time.
Metro Health also tells me that once the vaccine is more widely available, the good news is they have the resources to give it out rapidly. Live tonight for the Night Team, I'm Tyler Emery.